Welcome to What You Need to Know. This video will discuss what you need to know about two common diagnostic tests. The first test is an electroencephalography, EEG. An electroencephalogram, EEG, is a test used to detect abnormalities related to the electrical activity of the brain. This procedure tracks and records brainwave patterns. Small metal discs with thin wires, electrodes, are placed on the scalp and then sends signals to a computer to record the results. Normal electrical activity in the brain makes a recognizable pattern. Through an EEG, doctors can look for abnormal patterns that indicate seizures and other problems. The most common reason an EEG is performed is to diagnose and monitor seizure disorders. EEGs can also help to identify causes of other problems such as sleep disorders, brain tumors, abscess, intracranial hemorrhage, and other changes in behavior. EEGs may also assist in determination of brain death. EEGs are sometimes used to evaluate brain activity after a severe head injury or before heart or liver transplantation. Preparation is minimal. Hair should be clean and free of oils, sprays, and conditioner. Any hair extensions, pieces, or weaves must be taken out. This helps the electrodes to stick to the scalp. Do not take sleep aids or sedatives the night before the test, and your doctor may recommend that certain medications, such as anti-epileptic drugs, that can alter results be held before the test. Foods and fluids are permitted and encouraged, but avoid caffeine up to 8 hours before the test. Most EEGs can be performed in an hour and can either be performed in an area imaging center or hospital. To perform the test, you will be asked to lie on the bed or sit in a chair. The EEG technician will attach electrodes to different locations of the scalp using adhesive paste. Each electrode is connected to an amplifier and EEG recording machine. Even though the EEG is very safe, if you have a seizure disorder, your doctor might want to stimulate and record a seizure during the EEG. A seizure can be triggered by flashing lights or a change in breathing pattern. If the goal of the EEG is to mimic or produce the problem you're experiencing, the healthcare provider performing the EEG will know your medical history and will be prepared for any issue that may arise during the test. After the test, you will need to shampoo your hair to remove the paste. You also may need to use acetone to remove the paste. You may resume normal activity following the test. No recovery is necessary. The second test is myelography, myelogram. Dr. Stern of Premier Radiology will explain that test to you.
Thank you for that wonderful introduction, LaToya. What we're going to do now is talk about what a patient goes through when they come in for the procedure.
A myelogram is an X-ray examination of the spine involving the injection of a contrast material to outline the spinal canal and nerves. It is commonly performed to evaluate back pain, radiculopathy, spinal stenosis, and disc herniation. Prior to the myelogram, you will change into a gown. You will then be taken into the myelographic suite. After you lay down on the examination table, the physician will use an X-ray camera to determine the best location for the spinal injection. Your skin will be cleaned with betadine, an orange iodine-based soap which will feel cold against your skin. A sterile drape will be placed and you will be given some numbing medicine called lidocaine. The numbing medicine will cause a slight stinging and burning sensation as it is injected into the tissues. During the contrast material or dye injection, you may experience cramping of your hips, heaviness of your legs, pressure or ringing in your head or ears, or you may even experience heightened pain. After the contrast is completely injected, we will remove the needle and a bandage will be applied. We will then take your myelographic X-ray images and you will be sent for your CT scan. Keep in mind that anytime a needle is placed through the skin, there are potential risks or complications, the most serious of which are bleeding and infection. There is also the rare risk of nerve injury or spinal cord injury. After the myelogram, you should drink plenty of clear liquids and remain in bed with your head slightly elevated for the next 8 hours. You should resume a regular diet and your usual medications. Avoid alcohol consumption for 24 hours and do not engage in strenuous work, exercise, physical therapy, or lifting for 48 hours. You should not drive for the remainder of the day after the procedure. This ends the review of a myelogram. Before the procedure begins, a physician will speak with you and answer any questions you may have.
Thank you, Dr. Stern. 2 important things to remember about the myelography. 1. Notify physician of any allergies to contrast dye, as well as allergies to iodine and shellfish. 2. Increase fluids after test to excrete dye. That concludes this segment of What You Need to Know About Diagnostic Test.